Hi there, it's New Zealand naturopath Eric Bakker, author of Candida Crusher and formulator of CanZita, the Candida dietary supplement range. Thanks for checking out my video. Today we're going to talk about stress, adrenal fatigue, burnout and Candida. In the early days of treating patients with Candida, I didn't pay too much attention to what probably most practitioners don't pay attention to today, and that's the patient's endocrine function, their hormonal balance underpinning often chronic or severe yeast infections, particularly people that don't recover, or people that recover partially then relapse and feel sick again and go from one doctor to another. So typically patients who are on who show me bags of supplements, boxes of products, they've been to 10 doctors and 20 naturopaths, and these are the patients I generally get. They've been everywhere. They often will have a component underpinning the condition which will keep it going. It's one of the maintaining causes. So the adrenal glands really are glands that help you recover from stress. People that have been unwell long term often, are stressed people. They're anxious people. They're stressed people. They're depressed people. They can't find any answers to their health problems. They get bounced around from one practitioner to another. They go from one blog, or they buy stuff on iHerb, or they go all over the place trying to feel well, and then at the end of the day, they're still not well. They've spent all this money. So think about why, recovery is poor with these people. When you think about the adrenal glands, you think about stress. Now, stress is something that affects all of us. We can't escape stress. But most of us get good sleep. We've got a balanced lifestyle. We understand the difference between work and play. We eat good food. We relax plenty. And our adrenals recover. But for quite a lot of people, the adrenals never recover fully. And I find this with many people today who are hooked into electronic devices, or people who have mortgage debt, relationship stress, nutritional deficiencies, heavy metal toxicities. I mean, the list goes on and on and on. There's 101,000 causes why people, get sick and maintain sickness. But healthy, strong bodies recover from all sorts of, latent viruses and toxicities, and most people will recover to quite a high degree. When you don't recover, however, a very smart test for you to do is an adrenal test. So a test to determine what your cortisol levels are like. So salivary cortisol is a better indication, more accurate indication of the 24-hour rhythm or pattern of cortisol in the body, as opposed to just doing one blood test, which doctors like to do. Pretty useless test if you're just going to do one hormone test. So doing 4 salivary cortisol tests in a 24-hour period is going to give me an idea on the cycle of cortisol, the rhythm or the balance of it. Now, I just had a patient on Skype before whose test came back very flat. And this is a lady, a 38-year-old lady who's had Candida for many years. She's got chronic fatigue. She's got fibromyalgia. She's got multiple problems. But when I look back at her case history, there was sexual abuse there. She's had termination. She's had multiple relationships, failing. She's had problems with her boss. She lost her property because she couldn't pay it off. Her father got killed in an accident. All of these things occurred to this lady in a period of about 5 to 7 years. She just had one tragedy after the other. And she got stressed. She got highly burnt out. And she's never really been well since. Now, this patient can't seem to get on top of her vaginal thrush. Now, as I said to her, the best way to fix it up is to treat it locally, but also to try and build up the underlying immune system, which is, very much affected by poor cortisol levels. So the adrenal gland produces cortisol every day. In fact, we produce about 7 to 10 milligrams of this hormone per day. Cortisol has a fantastically powerful effect to regulate many different systems in the body. It's one of the most important hormones that affects our inflammation. So lack of sufficient cortisol creates pain in the body. Too much cortisol can also create serious problems when it comes to inflammation. It can be more responsible for things like allergies and hypersensitivities. But what we typically find in people with burnout, they've got a lack of cortisol. They just haven't got enough there. So the immune system can't be powered up enough to help fight fungal infections, to help fight bacterial infections, to help get rid of parasites. And oftentimes when people have been sick enough, the cortisol goes down, the bad bugs go up, the beneficial bugs go down, the patient maintains this circle of sickness for many, many years. So the best way I find to get them out of it is to assess the adrenal function, treated appropriately with a correct lifestyle and diet, and I usually use some carefully chosen supplements for that, get their health back again, and the yeast infection's gone within 3 to 6 months, gone by default. So if you can relate to what I mentioned about this lady, burnout, fatigue, stress, money problems, relationship problems, hassles with family members, or long-term chronic stress, this is going to create a lot of problems for you. You need to deal with this really before you can deal with the candida effectively. So I hope that gives you a bit of an insight into stress and candida. Thanks for checking out my video today.